Oral minoxidil. Should you take oral minoxidil? Should you take the foam version of minoxidil, whether that be Regain or off-brand? Should you take the liquid or the one which you drop Rogaine or minoxidil as the active ingredient onto your head? Should you take any of them? Now, minoxidil in any form, essentially the impact is it stimulates blood flow. So if you have hair loss, which is a very undesirable thing to go through, and yet most men and even some females will go through over the course of their life, then one of the best modalities or treatment options you can utilize is minoxidil. In the 1980s, 1990s, initially minoxidil was in the form of Regain, being the name brand at the time at the least, and still a name brand now. And it was essentially minoxidil was transferred to the scalp via propylene glycol, which essentially is a form of alcohol. And you just get these little drops and you drop it on your scalp. And essentially, I guess the method of treatment is it stimulates blood flow. So that was the positive of minoxidil back in the day. And then over time, Regain came out with a foam version because a lot of people had sensitivity when they used minoxidil in the form of the liquid, e.g. the propylene glycol on their scalp. So a lot of people have found that to be very irritating to the scalp. And so Regain came out with the foam version, which is less irritating to the scalp. And then more recently, a product or a drug called oral minoxidil, which has been around for a long time, but it wasn't utilized because people believed it would cause issues with cardiac rhythm, heartbeat, and could impact the individual by having palpitations and the like. Has become more popular, essentially because various doctors, one in Australia being one of the leaders of market utilization of oral minoxidil, realized that you could use oral minoxidil at a lower concentration. So instead of being 40 milligrams, you could use 5 milligrams or 2.5 milligrams, and it would still stimulate blood flow and hair growth, but it wouldn't come with the deleterious or negative side effects that the higher dose of oral minoxidil, which is like around 40 milligrams, comes with. Now, that is the dosage used for patients with heart issues, because what oral minoxidil does as well as stimulate blood flow and hair growth is it also stimulates, or reduces, I should say, blood pressure. So that was the initial reason for the product. But the dosage used for blood pressure patients is 40 milligrams, which is 10 times, if not more, if you take 2.5 milligrams a day of oral minoxidil, that a patient would take oral minoxidil for hair loss purposes. Now, personally, initially in 2018, February, I started taking oral minoxidil. I started taking Regain foam, be it 5% strength, and I did that morning and night. And I did that for about till 2021 November. I did that for about 4 years, and it was a bit of a punish to utilize every day, because you got to put it in, you got to part your hair, you got to put it in, boom, part your hair, put it in, boom, part your hair, put it in, boom. And the thing is that you got to do it morning and night. So you wake up in the morning, and I was actually quite lazy at the time. I would just put it in before work. So I wouldn't even style my hair. I just part my hair, kept it quite short at the time, and I'd just put it in and then go to work. So your hair's looking slightly greasy and it's looking thinner because the liquid the liquid takes away from your hair thickness in the sense that it clears a path to get to your scalp. So the areas you apply the foam, I should say the foam, I never use the liquid, but the foam, when it's on the scalp, it makes the hairs look even thinner. So it doesn't have a good immediate visual impact. So it was a bit of a nightmare. And then where I lived in Hawke's Bay, New Zealand, which is on the east coast of New Zealand, it was quite hot at night. So you'd be applying this minoxidil to your scalp, and in the form of regained foam, and you'd be sweating, and it wasn't ideal. It wasn't really what you wanted to do. So I realized there's got to be a better way. I don't know if I want to be doing this my whole life. Imagine when you're married, and it's like, you're ready to go to bed. Oh, I gotta apply my regain foam. It's just another task, and it takes time to do it properly. It doesn't take 10 seconds or a minute. It takes like 15 to 20 minutes to put it in and apply it, and put it in and apply it. And then you're sweating because of the humidity of where you are. If you're in California, if you're in Texas, it's going to be very hot. There's places like that all around the world, Colombia, Mexico. It's just not really a sustainable method in order to have a high-functioning life, or even a life which you're going to get enjoyment out of. So I realized there's got to be a better way. And that's when I started hearing a bit about oral minoxidil. I started doing a bit of research online about it because it became a bit more popular. And then I communicated with a few doctors, and they said, look, we've had patients who've used it. Now, these are doctors who aren't general practitioners. They specialize in hair, whether they be hair transplant surgeons, which a lot of them are. Usually, if a doctor knows about hair, he tends to be a hair transplant surgeon. General practitioners know nothing about hair because they're generally trained. So they don't have that specialized knowledge of hair. And I've actually been to a few GPs who will just say, oh, if you're losing your hair, which I was at the time, hence why I took minoxidil, or applied regain foam. Oh, just shave it, bro. You'll still look good. It's fine. It's like, bruh. Do you know the impact that hair has on your aesthetics? And you're just gonna shave it, like, mate. Especially if you're more down the pretty boy or cute side of things. It's not the best look to have a shaved head. And the amount of people who can pull off a shaved head and actually look better or as good as they did when they had hair is 0.1% of the population, if that. People always refer to The Rock, Jason Statham, but the majority of people aren't 6'4" and 250 pounds with very caramel skin, e.g. The Rock. Or they don't have elite facial hair genetics like Jason Statham, and quite a large forehead, which balances quite nicely with his facial hair. Obviously, as the forehead gets more exposed with his hair loss, extensive hair loss increasing over time. So the majority of people can't get it done with hair loss, okay? That's reality. Don't ask your friends and family when you're losing your hair. They're going to say, oh, you look fine, you still look good, etc. Lies, fake news. You know deep down how hair loss impacts you and how much of a negative it is in your life, dating life, social life, career. It really brings you down. So you want to get it sorted. And oral minoxidil, or minoxidil as a whole, so kind of long story short, eventually I got to start taking oral minoxidil in 2021 November, start at 2.5 milligrams. I did have a bit of a shed because when I was taking the regain foam, I apply it to certain areas, but not the whole scalp, whereas oral minoxidil works on your whole scalp. So there's obviously areas of thin hair which, are going to shed it from the initial treatment because the blood flow, the oral minoxidil is pushing those weaker hairs out, and those thicker hairs will come in time. But hair loss, the hair cycles are 3 months, so it takes time for this to happen. But eventually, it's just had a massive improvement on my hair. I mean, I'll do a little bow for you so you can see. And, oral minoxidil is one of the things which has helped me. It's helped with thickness, it's helped with the volume. My hair's a lot more, like you pull it, and it's a lot more, it's just stronger, right? Like, it just feels stronger, it just feels better. So it's something I definitely recommend being on. As long as you're on the lower dosage like I am, then you're good to go. It's you're not going to have side effects on such low dosage. 99% of people aren't. In fact, I've never met someone who has had side effects on low dosage of oral minoxidil. Look at the literature, look at the medical papers. It supports the low dosage oral minoxidil approach, and it also has great outcomes. So, any questions? My Instagram, Brewster563, which is spelled BREWSTER 563. Hit me up there. I'm happy to help you conquer hair loss, get on top of it, and get the best outcome for you in your life. Because hair loss, whether we like it or not, massively impacts your visual appearance, which has a massive impact on your life and how people view you and treat you. So if you want the reality, if you want the truth, you want to get on top of that. Hair frames the face. There's a reason why the majority of celebrities overwhelmingly have phenomenal hair. And a lot of those guys take oral minoxidil, along with a few other medications, which I'll get onto in future content. Thank you.